All right, come with us to our very first appointment at the neurosurgeon for Mr. Sirr. Of course, whenever we go to a new specialist, I have to dress my baby up really cute. And it's Christmas time, so he got on his little Santa outfit. His onesie says, I'm so cute. You can't see it because he's just so chunky butt, juicy butt, mama.
You can pick them up.
How big is it?
I got 44.3.
Is that normal?
I have to look in the system.
Okay.
I just got a clipboard.
Say, what's 44.3? Oh, Lord. What it is? So put your tongue back in your mouth, sir.
Take off all these boots.
I don't know, I'm going a little too fast right here.
So this is the back of your skull and your neck here. This hole where the head meets the neck is called the foramen magnum, okay? And this is where the brainstem converts to the spinal cord in your neck. Kids with achondroplasia, this part of the skull is very vertical. It's very sharply this way. So most of us kind of sit like this.
Mm-hmm.
For achondroplasts, they usually are much more straight, and it narrows this space down quite a bit. When it narrows this space down, it really makes the space for the spinal cord and the lower brainstem very, very tight. And so what kids do naturally is that they extend themselves to try to open this space up as much as possible to help them breathe. Okay? Typically, if you have that, we get an MRI scan, and then we take a look, and a lot of times if it's really, really tight and narrow, then we talk about removing the back part of the bone here,
Okay.
and removing this bone here, and that usually opens up that space, and they're better.
Okay.
Okay?
So you mean like a back of the skull? A piece of the skull?
Back of the skull and back of C1, the arch of C1. That's usually what is narrow and really tight back there.
At this age, we would do that?
If he needs it.
Okay.
So the first step is getting an MRI. So some kids come in and they're struggling to breathe during the day.
I got what you're saying.
And then it's an emergency. We admit you to the hospital.
Okay.
Get an MRI scan and take a look.
Okay.
I think for Sirr, he probably struggles, but it's probably something that isn't an emergency.
Right.
And it's likely, we'll let you have the holidays. And then in the new year, we'll probably talk about getting a MRI scan, and then taking a look at that and probably operating after that. Okay. But probably sometime in January, getting it all set up, getting it all taken care of if we need to, right?
Yes.
We definitely will do the MRI scan. We just don't know what the MRI scan will show.
Right.
And if it shows that everything looks fine and there's no pressure on the spinal cord or brainstem, we just watch it for a while and say, sometimes you can arch heavily from terrible reflux.
Okay.
But in kids without achondroplasia, we start with the reflux.
Not the breathing.
We don't, but the pediatricians say, oh, it probably is reflux. We'll start you on all these medicines.
Okay.
And if that helps out, then it looks better. In kids with achondroplasia, most of the time it's because of this.
Yeah, because so what's so crazy is his first genetics appointment, the doctor had mentioned it, but he wasn't doing it yet. Because he was so young. He was so young. He was like a few weeks old, and he was like, is he turning his head back? He was asking me these proactive questions. And so we just went and seen him again after we had a 3-month, follow-up. And I was, telling him, like, yeah, he's doing, like, everything you mentioned on the first appointment, which I didn't see in my other daughter who has achondroplasia, so it was all new to me. And then that's when he referred us over, here. So it was like he knew that he would do that before he did it.
I think a lot of kids, I think it's a standard question.
Oh, okay.
He's a good doctor.
Yeah, he's a great doctor.
It's a standard question for every kid with
Okay, yeah.
Stuff, right?
So that was his first appointment. We're not sure yet if he needs the surgery, as you guys heard the doctor say, but hopefully this was educational to another parent with a baby with achondroplasia. Don't forget to follow my YouTube for more educational videos at I Am Only a Bearer at youtube.com. Thank you guys for always supporting our family.